the founder and director of the Pink Lotus Breast Cancer Center in Beverly Hills, Dr. Kristi Funk. And I'm so glad you're here to talk about this, because last month a study came out of Canada, right, which they were saying that it's not necessary to have a mammogram every year. It just absolutely, I couldn't believe that they would say something like that, because it caused a lot of controversy.
Well, it does. It always, every few years, a new study seems to come out that throws this mammogram question into the air, which I love, because I get to come on air with folks like you and talk about it, because there's still some strong stats that can never be refuted. So basically, if you look at all of the randomized controlled trials that have ever been done on looking at mammograms yearly versus not doing mammograms yearly, there have only been 9. 2 of them say mammograms do not reduce the death rate from breast cancer, including this one. The other 7 irrefutably show a drop between 20 and 36% in dying from breast cancer for those who get mammograms. So, I mean, you've got 7 strong studies versus these 2. You need to step back, though, and say, what is it about this study? Because it is powerful.
What is it about this study?
Well, I'll tell you. What it is about the study is there's 90,000 women who have been followed for 25 years. So it's very powerful in terms of numbers. 90,000 women divided into 2 groups of 45,000. This group got a mammogram once a year for 5 years. This group, no mammogram, just self-breast exams and a doctor's exam. Okay, end of 5 years. Mammogram group, 666 cancers. Exam group, 524 cancers. Now let's follow all of you cancers. For 25 years, death rates are identical. So the conclusion,
conclusion.
So the conclusion is, even though you found more cancers with mammo, at the end of the day, the same % died. So you didn't save any lives by doing the mammogram, so just wait until you can feel the cancer. But here's the beef I have with the study. In 1980, you're literally talking about the first mammogram ever built. So back, even though 1980 to most of us sounds like, well, that was just yesterday, actually, in 1980, I was in love with George Michael and thought I had a shot.
Me too.
Yeah, right?
I would have fought for it.
Totally. Some guy would have won.
I thought you had a shot. That's funny.
But the point is,
now,
it was a long time ago, and this first mammo ever made the breast tissue look like a snowstorm. And this very study proves my own point. If you look at the nitty-gritty results, which, by the way, very few people that have talked have been given as much time as you're giving me now, so people don't know this, you have to know this. 68.2% of the cancers in the mammo group were palpable. They measured 2 millimeters less than the ones that were felt in the exam group. Well, I can tell you, save your 25 years. 2 millimeters is not the difference between life and death. But look at the other group. No one has said this. First ever. Here's a world exclusive for Home and Family. The 32% of cancers found by mammo that were not palpable, a la 2014 mammograms that find these teeny tiny things, death rate dropped by 18% in that group.
Well,
25 years later.
Why are people talking about that?
That's not sensational. That's not going to get the headlines.
It's incredibly irresponsible to put out a study like that and then make people think, oh, I don't need a mammogram. That's so irresponsible.
Well, the entire country of Switzerland stopped doing mammograms.
What?
Wow.
Yep, they recommend no mammography. That's the recommendation.
So if you were to redo this test now, the results...
Well, now you're going to use an iPhone to take pictures instead of a Polaroid. You're going to use the latest and greatest digital mammo techniques, which, by the way, I'll be the first to say, are still insufficient when it comes to finding all cancers. So it's mammography, plus a clinical exam with your doctor once a year, plus a self-breast exam every month.
What about ultrasound?
If you're dense-breasted, which means despite our best digital technology, your breast tissue still looks like a snowstorm and we're looking for a white snowball called cancer, you want to add either whole breast screening ultrasound or something Pink Lotus offers, which is a contrast-enhanced mammogram that subtracts out the density. Or if you're very high risk, besides the density, do an MRI.
But the death rate for breast cancer has gone down over the last couple of years.
Well, that's the brilliant point about this, how ridiculous the study is in Canada. So if you look at the death rates from breast cancer from 1990 to 2007, it has dropped 30% in America. 1990 is critical because what is that? That's 10 years after mammography started. We started finding these smaller, more curable cancers at the same time that treatments got better. So it goes hand in hand. But along the lines of the self-breast exam, I'd love to talk about the Get in Touch Foundation because this is a really amazing group. So Marianne Wassel, who's the founder, she herself had breast cancer, and at the time she had young girls that were 10 and 11 years old, and she wanted them to feel secure in doing self-breast exams and really understanding and getting involved and getting in touch with their own bodies, with information, with each other and their friends.
You're talking 10 or 11-year-old girls?
This is what this organization does. The Get in Touch organization, foundation rather, goes into all the schools. They're in 50 states and 26 countries. They teach 5th to 12th grade girls how to do a self-breast exam by using this innovative, kind of fun and not scary daisy wheel, which teaches them how to do one.
That's very important. I wish I had that when I was in high school because I never knew how to give myself a breast exam until my gynecologist taught me how.
This is not high school. We're talking grammar school.
5th to 12.
Yeah.
I think what I love about that, though, because at first you think, oh, don't tell a 10-year-old, like, do a breast exam, you could have breast cancer. That's not the message. The message is, you know what, this is a part of your body. Touch it, feel it, learn where their lumps are, because as you get older, this is my own theory, they don't say this, but I think it's really important, because as you get older, you start to have other associations, like your breasts have cysts and lumps and pain, so you don't really want to touch them, it kind of wigs you out to do a self-breast exam, or you have other associations, be it breastfeeding or sexual things with your breasts, and it's like, you know what, I'm not doing self-breast exam. Honestly, if I ask my patients and they tell me the truth, I think maybe 5% of women do a monthly self-breast exam.
Yeah, I still have trouble doing it.
But if they taught us when we were young, we'd have different.
It'd just be part of your
normal,
it's like brushing your teeth.
I didn't learn how to do it until I was. I mean,
didn't
really
have a
on the show.
mammogram until a couple months ago.
Yeah,
well,
I had a mammogram on the show.
Oh, did you? And then on the show, actually, we posted to we have a website now. Which I think they're going to post up, but it's a link to our video that we did here on Home and Family. Remember, we went through like a really detailed 5-minute how to do a self-breast exam.
Yes.
And by the way, I just want to take a moment to raise a flag in honor of you. You're being recognized by this foundation for the work that you do. So congratulations. I know that must mean a lot.
Thank you.
Congratulations.
And I said Rob Lowe is presenting my award.
Wow.
So if you can't have George Michael, maybe.
More information on Dr. Funk
Thank you.
and her instructions on how to give yourself a breast exam. You can find that at easybreastexam.com.